Hi, Dr. Ashish. How are you doing today?
Good, Miss Meghna. How are you?
I'm doing good too.
Okay.
So, please tell me how you got into hematology.
I studied MD in transfusion medicine and immunohematology at Christian Medical College, Vellore. The journey started there, and after that, I've been working in blood bank and hematology department, helping in the bone marrow transplants, which has brought us to the day.
That's lovely. Many people hesitate to donate blood or are scared to donate blood. So, can you please share some health benefits that would encourage more people to donate blood, maybe for the first time even?
The personal benefits of a person who is donating blood is when somebody comes for blood donation, there is a mini medical examination.
Right.
So one gets the opportunity to get screened for many diseases. We do check blood pressure, pulse, and other whatever mini medical examination happens, so that the person is all fit to donate.
Right.
If a person's hemoglobin is less, we do check for hemoglobin. If a hemoglobin of a person is less, then we don't collect blood from them and we suggest them what needs to be done to push that hemoglobin up to normal levels. Now, some people will have very high iron built up in their body. Anything of excess is bad. Even like blood sugar, when it goes too high, it becomes diabetes. When
Right.
body weight increases, it's obesity.
Correct.
So anything of an excess goes bad. Similarly for iron also, when iron is too much surplus in the body, that causes iron toxicity, and donating blood on a regular basis ensures that the iron levels are kept in normal levels. Then when the iron levels are in normal level, these donors who are donating blood regularly, because we are checking their hemoglobin every quarterly when they are donating blood, so their cardiovascular system, their heart also works in a better way.
Right.
And good hormones like serotonin gets released when they are doing something good.
Right.
This altruistic thing has a thing that they ensure a health in the entire body, even though it may not be visible outside.
Right.
When somebody donates blood, a lot of calories are burnt.
Correct.
So
Yes.
we do lose calories, and the red cells are made of lipids, that is the cholesterol. So cholesterol drops a lot, but I will not say that this is the way
Yeah.
to lose blood or lower cholesterol. We have,
And also it like the body is pushed to create new red blood cells, which doesn't usually happen unless we lose blood due to an injury or something of that sort, right? So this in a way regularly sort of has that the body kind of regularly creates red blood cells, and that's also a great health benefit.
yeah, when you are donating blood, you are donating the old blood.
Right.
The blood which was formed a few months ago. So
Correct.
the normal life of a red cell in our body is 120 days.
Right.
So when we are donating blood, that is 4 months old blood we are donating, or 2 months, 3 months old blood we are donating.
Correct.
But this pushes the body to produce fresh blood cells.
Right. So, doctor, you have seen thousands of donations. What psychological or emotional impact have you seen in regular donors?
When people donate blood, a gush of good hormone comes up into
Right.
them. That itself brings a positivity to them. People who donate blood more frequently, when we meet them, they appear more confident, they appear more healthy, because they are taking care of themselves.
Right.
In fact, they know that they have to maintain a certain healthy lifestyle, because next time when they come, they should not get deferred.
Right.
If they have less hemoglobin, or they have not maintained a healthy lifestyle. So this pushes people to remain happy and remain good.
Okay. So you have seen that people take an active effort to, be more healthy and include maybe more greens into their food, better diet, more exercise, things like that, just so that they're able to donate regularly. And you've seen that in regular donors.
Yes, people actually, someone had a thinner vein. So the person asked me, can I donate? But we saw that no, the person veins are thin because more fat around. Then the person had the vigor, the feeling that no, let me lose some weight so that my veins come up good, and I want to donate platelets which require a thicker vein.
Oh.
So the person actually did good exercise, came up with
That's
good vein, and
amazing.
we had to collect that from the person.
That's amazing. That's such a great way, like that we've actually motivated someone to change a major part of their lifestyle, and that's really great. So, what would you say to someone who feels like I'm just one person? How much difference can my blood really make?
So many people say, मेरे एक से क्या होगा? I will say, ऐसा सोचो, एक एक करके ही सारा होगा. So when you are pitching in, you are bringing your work, and when you put it in social media, not to boast, but actually it motivates so many others. It pulls in. It brings that magnet effect. It pulls in. So do you know a thalassaemic patient requires how frequently blood transfusions? So these patients are having genetic defect. They don't make blood in their body. So they require blood every 3 weeks, once and every 3 weeks. I can donate only once in every 3 months
Right.
whole blood. But even that once in 3 months, if I donate and I bring three more of my friends and they bring up some more, entire chain gets created and that
Right.
patient gets benefited.
Right.
So एक से ही बहुत कुछ होगा.
Right. So it's like that one person can make all the difference because they hold the ability to not just bring other people but to inspire more people to come forward.
Yes, and in fact, like when one person donates blood usually gets prepared into multiple components: the
Right,
red cells,
right.
platelets, and plasma. So and it goes to each type of a needy patient. A person is bleeding, it goes platelets goes to a person who requires that. A person who has less hemoglobin, red cells will go to that. So you are actually touching minimum 2 to 3 lives when
Right.
you are donating blood.
Right.
So
So like
it's
we
a-
always say, right, 1 unit of blood can save up to 3 lives.
yes,
So
yes.
yes.
So it
that's
helps.
So doctor, is there a long-term value or a habit-building value in becoming a long-term donor?
Yes. So when people donate blood regularly, they take care of their body more.
Right.
They ensure that they eat proper diet, they maintain a healthy lifestyle, and it takes care of their long-term life. There are people who have donated very high number of times. I started my blood journey when I was about 18 years old. I donated for my mother when my mother was undergoing a surgery. So me, my father, my uncle, all we went and we started as a replacement blood donor. Because I donated blood at that time, I came to realize no, blood donation is safe. So I started going to blood donation camps which were happening nearby. That some patient requires it. My mother required it, and at that time, lucky we were 3 people. Otherwise, alone I would have helped. So I started doing it in my vicinity blood donation camps. Finally landed in medical profession and ultimately in blood bank as such. I have donated 102 times blood.
Wow.
I'm still standing strong, no problem as such. If we follow the correct guidelines which the blood banks give, how to donate blood so that we don't fall weak. Trust me, nothing happens. No reactions happen.
And we also have a lot of safeguards in place now, right? And every year they are updated. We update according to the government standards, right? So could you tell us a little bit more about that as well?
Yeah, so safety is the core part of a blood bank. So we blood banks are licensed to work. Drug inspectors come from the central government and the state government to see what work we are doing on a regular basis. Each bag is a one-time use bag only. It cannot be used for a second person.
Right.
So it cannot spread infections. The needles are integrated into the blood bag itself. So we cannot use the needle like second time. You cannot use the blood bag second time. So it's all safe. When somebody's donated blood reaches the blood bank, after reaching we do a lot of tests in that. HIV type 1, HIV type 2, hepatitis B, C, malaria, syphilis. Grouping is repeated by 2 people on 2 different platforms. Cross match is done with the patients so that ultimately the blood remains safe, because it's the safety that matters both to the donor and to the person the donor is trying to help. So both are getting help with that.
Right. So like from donation to transfusion, we maintain blood safety at every step essentially.
Yes, a lot of temperature controlled storage, a lot of processing happens inside the blood banks so that the blood remains very good, in very good quality when it reaches the patient.
Right. And these are little children who need it and who need it on a regular basis. So it's very important that, because they already have to do regular transfusion. So there's a lot of other things that they already have to deal with. So blood safety is no longer a concern, especially in our setting, because we are taking care of it from donation to transfusion.
Yeah, you see that what these kids gain by receiving blood every 3 weeks. They have to miss school because they have less hemoglobin, they can't study. They have to come to us to get transfused on a regular basis, and assume that if I say there is no stock, how painful it would be. Parents have to miss their daily wage to bring the kids for getting blood transfusions.
Right.
For me, it's that 1 hour of blood donation. But for that kid, what my kid does at home as a part of normal, which is normal for the kid to play around, to study, do everything, whatever a normal kid does, for that kid to get that to do, it all depends on the blood which you donate.
Right.
So your blood donation helps the kid only for 3 weeks, after which again he will require blood.
Right.
But those 3 weeks which the blood is buying for that kid is those 3 weeks of life for that kid, and it matters so much for that kid. Your 1 hour is 3 weeks for that kid.
That's so true.
I will tell one thing, there are 3 ways to help somebody. The easiest way is to say, I am with you. That brings some motivation that, okay, somebody is there with me in my trouble times. The second difficult way is to help somebody with our money. The most difficult way to do is to do with our body. When I am giving blood to somebody,
So vital.
without knowing whom I am giving, that is something which not everybody can do. That only the true inner heroes from us that comes out, we do it. We all like to watch Hollywood or Bollywood movies where actors or actresses, the protagonist keeps on doing something good, and we like to see them.
Right.
Because for those 2 hours, those becomes our inspirational heroes.
Right.
But when we donate blood, the hero from us comes outside.
Right.
Not the real hero, the real hero comes outside.
Right.
And that helps people
Right.
who are actually in need of my blood. So we all can be hero in that sense.
Absolutely. It's such a powerful statement, that the 1 hour can buy 3 weeks of life for a child. And I had goosebumps when you said that. I really did. And that is so true. And we see it day in, day out.
The first time I donated blood, it was for my mother. After that, the 101 times I've donated, I don't know for whom I'm donating.
Correct.
But I know that it will not be misused. It can't be misused if I'm donating in a good blood bank where I know that it will go to a good patient who requires it.
Right.
We can't it has to go to the patient. And at good blood banks, we ensure that blood is not wasted.
Right.
Because we have a scarcity of blood.
Correct.
So much scarcity because the kids are coming and contacting us that they require blood, and we have to ensure that blood has to be available for them. So that responsibility is on our shoulder, that your blood is not wasted and the patient gets the blood on time, the safe blood on time.
Correct. So doctor, from a medical standpoint, how safe is blood donation and why should people trust the process?
So blood donation is actually a very safe process if done properly. When we say properly, it means sticking to the things which the blood banks ask you to do. For example, when you are driving and if you are asked to have a seat belt or when you are riding a helmet, if you do it properly, then things are bound to go good. So when people are supposed to donate blood, we ask for a checklist of items to be done. Right. We share the checklist with the camp organizer beforehand. For example, we prefer about 5 to 6 hours of sleep minimum.
Right.
Before donation on the prior night. Then food. Nobody should donate empty stomach.
Right.
So we eat and we donate blood after that. A proper meal should be there within 4 hours of the donation, preferably 2-3 hours, but maximum 4 hours.
Right.
Adequate water before donation so that we stay hydrated in our body. And then when we donate, we are all safe.
Right.
After donation, the person should be lying down for next 10-15 minutes so that the body gets used to the body volume which has come up and down. And when the person gets up, again we ask the person to sit there for next 10 minutes where we give them some refreshments.
Right.
So that we observe the person during that period. If all of these are followed properly, the blood donation is a safe process.
Right.
When the needle is going in and after the needle has been removed, don't shake your arms. Keep the pressure applied for 2 fingers, firm pressure for the next 10 minutes so that the blood clots properly.
Right.
If we do all of these things, there is no hematoma which is going to happen, no weakness which is going to come, because people are afraid, will I become weak after donating blood? No. Right. If you have followed up all of these things which I just mentioned, your donation will be all safe. Of all my donations, of 102 donations, one time I skipped this. I had less food before donation. I had a bit of giddiness. Immediately I ate something and my giddiness went away.
Yeah, I've noticed this many times, especially if it's happening within office campuses and or within office hours, and people, they tend to come down during lunchtime, and then a lot of times I've seen you also personally tell them, if you've not eaten anything, if you've not had a breakfast, please go have lunch and then come back after lunch to do it. But then a lot of times people don't want to follow the entire process, right? And what happens is they just want to rush back. They'll be like, no, I have a meeting now. The corporate mindset of, okay, gotta hustle now. Did my good deed for the day. Let me get back to work. Let me start again. And, that's when a lot of times this giddiness happening or, people feeling little weakness and stuff like that. Now, the only issue is that when other people see that, they're only going to see the negative sides or the negative aspects of it, which is why it's so much more important that if you are a donor and if you are a regular donor or a first time donor, please follow the rules, because these are in place for your safety. We are not we're not like a school principal type of a setup, where we don't get any joy, or we're not trying to discipline you. We're just saying this for your own safety so that you are able to donate blood and remain healthy, and that there are no adverse reactions.
To ensure that we have a safety thing, we do check the body weight of a person, because the blood volume in a person depends upon the body weight.
Right, yes.
So there are defined guidelines by government that as per this body weight, person can donate. Above that can donate, below that cannot donate.
Correct.
So we do check body weight. We check the hemoglobin of a person so that we are sure that the person has good hemoglobin, good blood. then only the person donates blood. It helps the donor also, so that the person has less hemoglobin cannot donate less hemoglobin. We give a instruction, okay, this is the food we have to eat, this is the medicine which can help if required, but usually the food is sufficient. So we give a list of food what is good for the person. Then if the blood person is himself or herself having less hemoglobin, the blood going to the patient is also of poor quality. So we maintain that. We do check blood pressure of the person, so that if the person has good blood pressure, good hemoglobin, good body weight, good overall health, this is a questionnaire. When a person comes up, the person has to fill a big list of questions, because we want to ensure that the person is safe enough to donate blood also, and the recipient also should be safeguarded. So these are the checkpoints where we ensure that the safety of the person is taken care of. So what happens is, when a person comes, we give a blood donation questionnaire. The person fills his or her personal details, which includes health questions mainly. Takes about 5-10 minutes. Then we do a mini medical examination. Takes again 5-10 minutes. Then the donation happens, which again takes 5-10 minutes. You can say the person lies down for further 10 minutes, and then gets up, and we give reflections for further 10 minutes. So a person has to spend about 50 minutes to 1 hour. 50 minutes to 1 hour in the camp area. So we have to be prepared for that. If we have only 30 minutes, not gonna work out. We have to be prepared that 50 minutes I can spend in the blood bank. If I am at a hurry, I can tell the blood bank to prioritize for me, and definitely other donors will be very helpful. So we can do that, so that it saves their time. But this is the time points where if we follow that, it's all safe.
Everything's good. So Dr. Ashish, since you have been in the field with these blood donation drives, what are the fears that the common people have?
The most common question is pain, because there will be a needle there.
Right.
So I will tell something about the needle. The needles are actually thick needles. Because when you are giving a blood sample, you are giving only 3 ml, 6 ml blood. Here you are giving a bag full of blood. So the needles are thick. But these needles are designed in a way that they are atraumatic. So these are siliconized needles, and none of these needles are manufactured in India. The usual needles are definitely, but these blood bag needles are imported from Japan. So these needles are atraumatic, means they will cause very less pain. It will be false to say there will be no pain. There will be a pain when the needle goes in. After which the pain stops. There will be a little bit of pain when the needle comes out, and again the pain goes away in a few minutes. So the pain will be less. It will be there, but it will be for a small duration. And you consider the advantage you are giving to the patient. You consider this cost versus that benefit, and you realize, okay, this little bit of pain is still acceptable. Chalta hai. For the benefit that other patient is getting. If I'm on some medicine, will I be able to donate or not? So there are a lot of medicines which are safe to take, which are good. So like for example, blood pressure medicine. We insist, yes, you take your medicine on time, don't skip them. You take those medicines, you are able to donate. Blood sugar medicine. Yes, a person is taking diabetes medicine, can take. Only thing, on people on insulin we do not take, because we consider that in India usually these are given at the end stages, and there may be some end organ damages and all because of the disease process. So we don't take blood from people on insulin, but people on tablets for sugar, diabetes, thyroid, everybody can donate. Earlier there was a confusion that people on anti-thyroid, hypothyroidism medicines can donate or not, but now it's all clear. Government guidelines have come up which say that these are safe medicines, good for the patient, and does not cause any harm to the recipient. In case you are taking some other medicines like antibiotics or something, do reach out to the blood bank doctor, and the doctor will be able to guide you. Yeah, these many days have passed since you took the medicine. Now you are safe to donate blood. Or this particular medicine, even if you are taking, it's all safe. This lotion, ointment, it's safe. No problem. So that is the next doubt which people have. Again, another doubt which comes up is alcohol. So if I have taken alcohol, will I be able to donate or not? So the current guidelines say that you should not be under the influence of alcohol
while donating blood.
So if you have not taken alcohol today, you are all clear to donate. If you have, because we never say that don't party. You have partied yesterday night, it was a weekend, and you have come to donate on the next day, no problem at all. You had alcohol yesterday night, it has gone out of the body now. If you are able to sign the consent, do the regular, understand the process of blood donation, then you are all clear. Similarly for smoking. So though it's not a good thing, but it's okay. If somebody smokes, it's okay, no problem. Preferable gap should be 2 hours. Minimum gap is half an hour. So if you can avoid smoking for half an hour before donation and after donation, we are all good to go.
Right.
If you can avoid for 2 hours, it's even better.
Even better.
But half an hour is sufficient for us.
Right. You were talking about the medications, and this I am very curious. What are some medicines where you shouldn't be donating blood? Like maybe something where blood thinners or something of that sort. So, are there any medication that you would suggest?
Since you started with blood thinner, so we have to see why the patient got blood thinner on the first occasion. See, usually people are given blood thinner when they have some blood clotting issue or some cardiac heart issue or some brain stroke or something. It's not a problem. Only thing, we will not make platelets from that.
Right.
But why the person is on a blood thinner is the main thing, which we will anyways question the patient and try to understand and to defer. Antibiotic medicine is not the problem, but why the antibiotic was given to the patient. Some infection might be in the patient still, which can go to the patient who is receiving the blood and can by chance spread some infections. So we do ask certain questions, why is the medicine being given, and accordingly we take the decision.
Correct. Yes.
There is one question which people ask, I will donate only when my family relative needs it. It's a very common thing. So we tell the person, you have been waiting for so long to donate blood. We become eligible at the age of 18 years to donate blood. And so suppose I am age of 40. I had 22 years of missed opportunities. Each year I could have donated 4 times. So males can donate once every 3 months, females can donate blood every once in 4 months. So for last 22 years, if I was just waiting, then I missed 66 opportunities or 88 opportunities of donating blood because I waited for my patient or my family relative to fall sick. So that does not work out. Also, when my relative will require blood, am I sure that it will be only a single unit? If I require multiple unit, I will require help of somebody else to donate.
Correct. Yes.
And assume a scenario where a patient falls sick in the middle of the night, patient requires blood. At that time, if I call, it's difficult. Patient is bleeding there. I don't have blood stock ready with me. And patient relative may not even remember you. That, okay, you have the same group of blood because now I require the same group.
Correct, exactly.
So that is not feasible. So in the blood bank, we maintain a small inventory depending upon how much blood requirement is there for
blood. Blood has a shelf life.
Yes, shelf life. So we require a small inventory depending upon the blood group, and we issue it first to the patient so that patient does not suffer. And if you have donated blood voluntarily, that ensures that my shelf is there, blood is there, patient requires it, gets it. Do you know about 38% of the death in mothers, means pregnant females, happens because of bleeding, external bleeding during delivery, and which can be easily be avoided if I give the blood on time. These are preventable things which should not happen in this modern world, in this modern India. So just thinking that when I get a call, then I will come and step out. Many times the calls will never come in my life, and I will be keeping on missing the opportunities.
Yeah, that's why voluntary blood donation, that like Sankalp India Foundation, the way we focus on voluntary, and we are very, very big on the word voluntary. So we want it to be voluntary. We'll never come and try to convince you. We'll never try to force you. But it is a good thing. It's good for you. It's good for the patient, and it's good for the community. It's something that every responsible adult, every responsible citizen should take it upon themselves to regularly donate blood.
Yeah, I agree with you. Voluntary blood donation is very, very much important in comparison to replacement blood donations, and Sankalp is working extremely hard towards that because in our blood bank, we hardly have in-house donations. Mainly donations happen when we go for camps and the office people, they donate blood, or the residential complexes, they donate blood, and sometimes they come in-house and they donate blood because we do not ask our patients to donate. 86% of the blood last year from Sankalp went to thalassemia kids, and assume that the person has to donate blood every 3 weeks. Not possible for the parents of the kid to donate blood or to arrange such donors. You see why the world is moving towards voluntary blood donation. They are safer. If I have come to donate for my father as a replacement blood donor, but I have certain things which I cannot disclose, my health history, or there are so many questions I cannot disclose. There are sexually transmitted infections which can also get transmitted through blood, and we asked about that also. So there is a reason for me to hide that question if it's a replacement blood donation.
For a family member.
But for a voluntary blood donor, it's nothing to hide. If I have something, I have to avoid donation for next 6 months, okay, I will just skip, I will just tick, no, I am not eligible, and I can go home.
Right.
but the replacement donor cannot do. And that's why a voluntary donor is much more healthier donor than a replacement blood donor. And also a voluntary blood donor knows that he or she has to donate again after certain period, 3 months, 6 months, whatever is the donor's choice. So will maintain their lifestyle also accordingly.
Right.
As per World Health Organization, WHO, if only 1% of the eligible population of India can donate blood on a regular basis, there will be zero requirement of replacement blood donation. That means you walk into any hospital at any given time point and blood will be available for your patient. Only if only 1% of us keep on doing it on a regular basis.
We don't really have many in-house donations, which I would really like to make a case for it, because we have a beautiful facility here, and it's very safe and it's very convenient. It's a beautiful locality. You can come here, donate blood. It's a safe environment. It feels good. We'll not send you off immediately. You can relax here, rest for some time and go back. So I think we should have more people coming into our facility, and we'll make sure to add our the address and everything, so that anybody watching the video would like to come and donate blood, they can come by anytime.
Yes, that will be lovely, because donating in-house is a more controlled environment.
Correct.
You get a more personalized care where you are the donor and there is no rush or something. You
Right.
have your own time and it will be more safe. Our blood bank is actually very good, very clean. You'll love to donate here again and again when you just walk in once.
Right, of course. I'm looking forward to donating blood, like we discussed.
Welcome.
All right, Dr. Ashish, it was lovely speaking to you today. Got to learn a lot about what happens on the field, got to learn so much about the ins and outs of blood donation, and I hope that anybody who's watching this also feels inspired to donate, maybe for the first time, and also come back as a regular donor. Thank you so much, Dr. Ashish.
Thanks, Miss Meghna. Welcome.
Thank you.